So like I said, back when I was practicing, the technology was very different. We were only testing for a handful of genes. Now we test for 80 plus genes. I would say most of the large reputable reference labs that have been doing this testing for many, many years, those results I would trust, right? And again, this depends on where the testing is done. Most of the time, it's going to be done again at one of these larger reference labs that have a lot of experience. And I think clinical practice now is really moving towards these larger panels of genes as opposed to a single gene test for a single syndrome. So most people now are probably getting tested for large panels, 50, 80 plus genes. So if that's the case, if you've been tested at one of the larger reputable reference labs and you've had a large panel, there's probably not a need to do retesting or to test elsewhere. Again, those families probably unfortunately just fall in that 20% of cases where it's familial, but we just can't identify the single cause of cancer in the family. But if you were tested many years ago, or let's say your testing was only for a small handful of genes, and you're curious about whether there might be a mutation in some of the other, newer genes, then it might be something to consider.